Hi, my name is Madison Shalo.
And I'm Bailey LaRue. We are going to talk about the different specific jobs that go with a cardiologist.
So what exactly is cardiology?
Cardiology is the study of the heart. A cardiologist deals with the treatment and diagnosis of the heart diseases.
Like heart failure?
Yes, congenital heart disorder is one of the few types of examples of disorders they treat.
Why do we need cardiology? Doctors in this medical field are important because they help patients or people with the risk of heart failure or heart problems, current problems, or past issues. Cardiology is one of the few jobs that save lives in in-flight emergencies.
What makes cardiology interesting? There are so many career paths you can choose to follow in this work with the heart.
For example, cardiothoracic surgeon, vascular surgeon, and electrophysiologist, each of which are on our display.
Cardiology is a combination of acute and chronic medicines. It's sort of a best of both worlds specialty. There is a fast-paced critical illness, but they also have the opportunity to have long-lasting relationships with their patients.
The generalized education requirements are go to a college and get a 4-year bachelor degree. A couple colleges in Washington you can think about going to is Northwest University, Eastern Washington University, Evergreen State College, and University of Washington.
You also have to attend a medical school. Attend a 4-year medical school program. During the first couple of years of medical school, you have to take the basic courses, for example, anatomy, pharmacology, and others. In the later years, you will transition to the hospital setting. You do this under the supervision of doctors.
The third step is to get a medical license. This is a series of exams that show your knowledge and skills.
You also have to do a residency program. A residency program is a postgraduate training in the medical field you want to work in. This will take about 3 years to complete. You will learn how to handle yourself comfortably and confidently in many different medical situations.
Lastly, you need to complete a cardiology fellowship, which takes about another 3 years to finish. This time is used to teach you how to prevent, treat, and diagnose a range of cardiac conditions.
The average annual salary outlook of a cardiologist is between $150,000 to $300,000. Of course, this salary may change based on the specialty you choose.
A cardiothoracic surgeon specializes in surgical procedures in the organs in the chest. Problems they can treat are heart failure, leaking heart valves, and artery blockages.
The responsibilities of a cardiologist are medical management, deciding the method of surgical procedures, and diagnose the patient, and much more.
Secondly, a vascular surgeon operates on parts of the circulatory system. They also treat problems in the main arteries. A common disease is a peripheral vascular disease. This affects the arteries in the feet and legs.
The job responsibilities are performing surgeries to repair arteries and veins and treat other vascular traumas. Determine risks of surgery, whether the benefits outweigh the risks.
Lastly, we have an electrophysiologist. They perform tests that access the heart's electrical system or activity. They find out if you have an abnormal heartbeat or heart murmur.
The job responsibilities of an electrophysiologist are assisting and using complex equipment and performing and assessing with actual procedures. They diagnose and decide if the patient has potentially dangerous heartbeat.
The medical fields inside of cardiology vary so much, and you get to decide how you want to help people and while still working with the cardiovascular system.